Hello everyone, today I would like to introduce a medication called Eptinezumab Vyepti, which is the first and only monoclonal antibody drug targeting CGRP for the preventive treatment of migraines approved by the FDA for intravenous injection. Migraine is a common chronic neurovascular disease characterized by recurrent, unilateral or bilateral, throbbing moderate to severe headaches. There are 1.04 billion migraine sufferers worldwide. Compared to the male patient, female patients experience higher pain intensity, and the prevalence in women is slightly higher than in men. The 2017 Global Burden of Disease Survey's results show that, calculated by years of life lost due to disability, migraine is the second leading cause of disability. This condition can affect a variety of motor functions in the body and severely reduce the quality of life. Migraine can be divided into 4 phases. Phase 1, called prodrome, lasting few hours to days. Warning signs start. You could experience change in mood, fatigue and yawning, food craving, muscle tension, and sensitive to light. Phase 2, called aura, lasting 5 to 60 minutes. You may develop blind spots, see geometric patterns, or flashing, colorful lights, or even lose one vision on one side. Phase 3, called headache, lasting 4 to 72 hours. Throbbing pain may be present. It may be contained to one side of the head. Movement make it worse. Nausea comes on. You may vomit. Avoid bright lights, strong smells, and sounds. Pain usually goes away with the sleep. Phase 4, called postdrome, also called migraine hangover, lasting 24 to 48 hours. Some symptoms may linger, like unable to eat, problem concentrating, and sensitive and general mental fog. Unfortunately, I suffer from migraines as well. In my daily study life, I'm accustomed to drinking coffee to stay clear. If one day I forgot to drink coffee and overuse my brain, I may experience continuously yawning and difficulty breathing as precursors, followed by a strong throbbing headache, and I become extremely sensitive to light and noise. This is also why my classmates often see me with tears on my face. I often choose to drink coffee or take acetaminophen-type painkillers to relieve the pain, but these treatment plans have significant drawbacks. For example, drinking coffee to stay alert is because the brain uses a large amount of ATP and produces a large amount of metabolic product, adenosine, during activity. When energy is excessively consumed, adenosine acts like a brake of the brain, attaching to the receptors on neurons, gradually slowing down the central nervous system, and at the same time we became more and more tired. Caffeine molecules have a very similar molecular structure to adenosine, and they act as imposters competing with adenosine for receptor site, preventing adenosine from playing a brake role. In the mechanism of pain induction, adenosine plays an important role. It binds to the receptors on the surface of vascular smooth muscle to cause vasodilation, and it is also involved in the regulation of pain mechanisms. Therefore, caffeine inhibits pain by blocking the binding of adenosine to receptors. However, long-term intake of caffeine can cause the brain to undergo adaptive changes. Since caffeine is always occupying the receptors of adenosine, the brain will produce more adenosine receptors on the surface of neuron cell membranes. This means that more caffeine is needed to block the binding of adenosine, and once caffeine is lost, a large amount of adenosine will bind to the receptors, causing drowsiness, fatigue, and even severe migraines, also known as caffeine withdrawal. In other words, caffeine withdrawal is one of the causes of migraines. Is it feasible to take painkillers immediately when a headache occurs? Similarly, the answer is no. Although taking rescue medication as soon as symptoms appear is very important for quickly stopping a migraine attack and reducing the risk of a disease becoming chronic, overusing them poses a significant risk. We should avoid using acetaminophen and inert more than 15 days a month, and avoid using triptan, butabitol, or orgate more than 9 days a month. Frequent use of this medication can lead to a different type of headache called medication overuse headache. The more painkiller you take, the more painful your head becomes, and the more you have to take painkillers, thus falling into a vicious cycle. Therefore, people who are troubled by migraines are still calling for more effective and less side-effect special drugs. The CGRP is a neuropeptide composed of 37 amino acids and is one of the mediators of neurogenic inflammation. CGRP immunoreactive nerve fibers region from the trigeminal ganglia. If we consider neurons as two neighboring residents, then CGRP is the messenger of their communication. Stimulating the trigeminal ganglia can cause the release of CGRP, which is to tell the next neuron it's time to dilate the cerebral blood vessels and trigger a migraine. What people need to do is to accurately find this messenger in the human body and prevent it from conveying this message. Currently, all migraine therapies based on CGRP targets have achieved positive therapeutic effects. Eptinezumab can selectively and rapidly bind to the alpha and beta subunits of human CGRP at very low concentrations, just like two pieces of puzzle that can fit together perfectly. Due to its special shape, Eptinezumab only binds with CGRP in the body, preventing CGRP from binding it to receptor, throughout causing it to lose its function of conveying information, leading to its inactivation and blocking the activation of CGRP receptors, thereby achieving the purpose of pain relief. After binding with CGRP, Eptinezumab dissociates very slowly, so its therapeutic effect on migraines is fast-acting and long-lasting, providing preventive treatment for migraine patients. In terms of dosage and administration, the recommended dose of Eptinezumab is 100 mg intravenous infusion every 3 months. As the only intravenous treatment drug for migraines, Eptinezumab has the advantage of long dosing intervals, high patient compliance, and good safety. Of course, like any medication, Eptinezumab also has certain side effects. The most common adverse reaction events are nausea, anaphylaxis, and hypersensitive reaction. Therefore, before treatment, patients need to have a full communication with their doctor to understand the specific details of the treatment plan and the potential risk. That's the end of today's video. If you enjoy, leave a like, and I will see you next time. Bye bye.